Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, after fearing for her safety due to red tagging claims, the Maginhawa Community Pantry resumes operations today. The Interior Department denies any order to stop or profile community pantries affiliations, but are permits necessary? Interior spokesperson and Undersecretary Jonathan Malaya joins us live. Also, as coronavirus cases continue to soar, what to do when COVID-19 hits home? Pediatric infectious diseases expert Dr. Anna Ong Lim will be joining us live. Medical experts say hospitals remain full as COVID-19 cases continue to increase. But what to do when COVID-19 hits home? Let's go straight to the source of the story. We have pediatric infectious diseases expert Dr. Anna Ong Lim. Dr. Anna, good to have you on the source, and thank you for your time.
Morning, Pinky.
So let's start with this. We're still seeing high daily infections. Yesterday, I believe it was 7,000. That would be called an artificial decline because a number of the laboratories don't really operate on Sunday. So hospitals also remain full. And while majority are, those infected are either asymptomatic or mild at about 98%, and these people are actually advised to stay home, it's good to talk about home care. So, tanong ko muna, Dr. Anna, tell us the primary difference between a flu and COVID-19. How can we tell?
The problem kasi, Pinky, is that the symptoms overlap too much that it's not actually possible to tell clinically whether someone has flu or COVID. And in fact, at this point in time, because COVID is more commonly encountered compared to flu, if somebody came to me and told me that I am running a fever with cough and cold illness, my first instinct would actually be to test first for COVID rather than consider flu.
Would a telltale sign be yung loss of hindi mo na matikman yung pagkain mo, hindi mo maamoy yung pagkain mo? Pag yung ba yung loss of taste and smell, sigurado na hubang COVID yon?
Well, the likelihood is yes. But the thing is, Pinky, not everybody gets that symptom and it doesn't set in right at the start. So if we were going to use that as basis to make a decision whether somebody should be tested or isolated, it'll come pretty late in the game and maybe not at all for some people.
That's true. I actually know someone who started with a sore throat and then nawala po yung kanyang panlasa on the parang 5th or 6th day. So
Right.
How do we confirm that one is actually positive, or is it even necessary?
The recommendation really is to do a test with an RT-PCR if that's accessible. But currently, some of the rules have been revised to provide earlier testing results. So for patients who have symptoms or who are contacts of those with symptoms, an antigen test is already being considered as proof positive that somebody is sick. Pero kung negative yun, we need to still reconfirm with an RT-PCR.
Okay, so the scenario is, Dr. Anna, nag-positive siya through RT-PCR or even antigen, or wala siyang way to be able to test. Pero suspected na siya, or ang sabi ng doktor, mukhang ka na talaga, positive COVID-19 patient. So what are the essentials? Kasi home care. So anong mga kailangan i-prepare natin sa ating mga bahay just in case may mag-positive po sa atin?
Okay. So, Pinky, let me go back a few steps and talk a little bit more about identifying the patient. Kasi our typical tendency when we feel something is pinapakiramdaman natin. We kind of try to ride it out for a few days and consider other differentials, other possible diagnoses. Lalo na for COVID, diba? There's this really strong sense of, naku, hindi sana COVID to or ayokong COVID to. And there's a little bit of denial. So there has to be a change in paradigm. hindi pwedeng pakiramdaman and you go around your household or your workplace or the community while you're feeling sick. The paradigm should be once you're sick, you isolate, then you can decide whether you want to be tested or not. If you choose not to be, then you're committed to isolating for at least 10 days. And that also brings about the same thing for your family, no? Ang advantage lang actually ng testing is kung nagkataon na negative ka, and tama na yung timing ng test mo, reliable yung test, you and your family may be released from isolation and quarantine. But without that, just to make sure that you don't infect other people, then you need to be isolated. Your family needs to be quarantined. Now, what do you need to prepare? Maganda yung tanong mo habang hindi pa nagsisimula, dapat nakahanda na. And it's really just the basics of providing for treatment for fever, cough, colds, and making sure that you can contain the infection within your household by providing everybody with PPE, cleaning and disinfection supplies.
Okay, but ano po yung mas essential? For example, what do I prepare right now? I need kasi they're saying from various chat groups, you need definitely a thermometer, kailangan mo ng paracetamol. Ano pa ho ba yung mga basic essentials?
So, ang dapat na nasa isip natin to cover all of the bases is, kailangan ko ng gamit para pag kinakausap ko yung doctor ko or yung healthcare provider ko, nagkakaintindihan kami. So, yun yung mga monitoring equipment, temperature, a thermometer, no? You need a way to relay your heart rate and respiratory rate. Kung meron ka sigurong condition that requires monitoring of BP, ever since, so dati mo ng pre-existing, then maganda sana kung meron kang BP monitor. Then kung may access ka to a pulse oximeter, mas madaling makipag-usap sa healthcare provider mo kasi di na kayo naghuhulaan kung kumusta yung level ng oxygenation ng pasyente. Then of course, you need a way to record all of this systematically, again, para when you're relaying information to your healthcare provider, madali yung communication.
So dapat may journal ka na at isusulat mo na doon. So when you talk to your doctor, you're able to log in and tell the doctor what your blood pressure is. What is that? Yung oximeter, kailangan ho din ba yun sa bahay? So thermometer, sana merong pang blood pressure, gamot, which is paracetamol. What about that oximeter? Like I don't have that. Is that essential?
Well, I wouldn't call it essential naman. I'm not thinking that everybody should rush out and order it or buy it from medical supplies, no? Ang problem kasi with COVID is that we know that once the oxygen level starts dropping or the oxygen saturation starts dropping, then that's an indication that the patient needs more care, maybe most likely in a facility. Now, you can relay that information through observation. You can tell the doctor, mabilis po yung paghinga parang more than 30 per minute, or parang hinahapo siya, can't even complete a sentence pag nag-uusap kami, or pag naglalakad nakikita ko na hinihingal, or pwede ring medyo iba po yung kulay, doc, parang medyo namumutla, no? Pero without going into that, because those are really subjective observations, if you had a pulse oximeter and you read it and you saw that the number was less than 94 without any supplementation, then your doctor already knows, okay, we need to go to the hospital. Wala na masyado pang usapan and recalibration based on observation.
So kailangan, pag 94 and lower, kailangan mo nang pumunta sa ospital?
Or kailangan mo ng consult at the outset para ma-advisean. Kasi may mga conditions naman na pre-existing that might lead to an acceptable lower level. Pero kailangan may konsulta.
Doc Anna, so you're positive, you're home. Sinabi niyo na po yung essentials. How does one, let's go to the asymptomatic and mild pa lang, take care of oneself? Do we need to load up on vitamins? And what are these vitamins? I'm hearing definitely C, D, magnesium, zinc. Are those all necessary as well?
So let's focus on the adult patient siguro, Pinky, no? Kasi yung candidate natin for home care needs to be somebody who's fairly healthy. May mga risk factors, so let me mention that. Dapat less than 60, dapat not more than 60 years old, walang hypertension, walang history of smoking, hindi obese, walang pre-existing heart, lung disease, kidney disease.
Asthma.
No? So basically in good health. functional. Tapos, nagkataon, nagka-COVID siya. So, ang inaasahan natin is, bibigyan lang natin siya ng area that is separate from the rest of the household with single room and bathroom preferably. And then the only thing we will need to do is kukumustahin siya paminsan-minsan, dadalhan ng pagkain, then see you in 10 days. Parang ganun lang dapat yon, no?
Okay.
So, hopefully ganun nga kasimple yung pagdadaanan ng tao kasi basically in good health siya. Now, bibigyan mo ba siya ng vitamins? The guidelines coming from the medical society say na walang masyadong benefit kung magbibigay ka ng vitamins kasi wala ring impact dun sa prevention and treatment. But if, for example, before your illness, you were already on a restricted diet or you already had signs of deficiency that was part of your regular medication, then you should continue taking it.
But that's the problem, Dr. Anna. A lot of us hindi alam kung saan tayo deficient. In fact, only a blood test, no, blood chemistry will tell you kung saan vitamins ka deficient. So, but they'll still help, no? Makakatulong pa rin yung mga C, zinc, D, vitamins.
Well, siguro let me put it this way. Kung sumobra naman yun sa katawan mo, lalabas din siya, iihi mo rin siya. Pero yung D kasi, medyo fat soluble, so it takes a long time to degrade in your system. So maybe if you had pre-existing liver disease, I'd be very, very cautious about it. I'd consult with the physician and ask what dosing would he recommend.
I also read something. I think it was published in the Lancet, Dr. Anna, no, that this budesonide will also be good for COVID patients who are recovered. If you use budesonide, it will lessen the recovery period for mild cases. Is that true?
So that's actually a newly published study, no, and it's still being evaluated for the local guidelines para malaman kung saan natin siya magandang gamitin at what stage of the illness. Kasi hindi siya pang prevent, no. Malamang pipiliin natin yung merong symptoms already in the mild phases bago siya pasisimulan. So again, evaluation by your physician.
And just siguro for clarification, budesonide is a turbohaler for asthmatic people. They use that. So that I read na that article, no, that said na kapag mild ka, it can actually help speed up mild cases recovery. So let's talk about, okay, nandiyan na siya, maswerte, may banyo, may sariling banyo, meron pong sariling kwarto. What's the monitoring process? What should one do in a day?
The monitoring is really to observe trends and reassure yourself and your healthcare professional that you continue to have normal findings. So in the WHO guide for home care, it says you can do your monitoring once a day. If you were in a healthcare facility, you would probably be monitored at least every 8 hours. So I would suggest, no, for your own peace of mind, maybe 2 to 3 times a day of monitoring at specific hours, like maybe every 12 or every 8 hours. And then checking your heart rate, respiratory rate, your temperature. And if you had a pulse oximeter and a BP monitor, then you could do that too, no? And then basically establish, no, a regular communication schedule with your doctor to update him or her about your progress. The teleconsults can also be a way for the doctor to assess how you're doing kasi the interaction will provide them with the information they need to decide whether you need to be in a facility or you can continue being home. On a regular day, you would probably just need to be taking your regular maintenance medications, paracetamol if you're running a fever. And a lot of people with COVID say they feel so tired the rest of the day that they just sleep and sleep and sleep and basically just rest, no, and make sure that you're well fed, well hydrated.
What about this? How do you know that you're just mild and that it won't progress to a moderate case?
Okay. So the criteria for mild basically rests on making sure that you are breathing comfortably. So the objective parameter is counting the rates of breathing per minute, which should not be more than 30 for adults. And this is like during a calm resting state, no? Hindi yung parang kakatapos mo lang magpagod and so on. And then your interactions or rather your activity should not cause you to be short of breath, no? Yung kaya mong gawin on a regular basis, dapat di ka hinahapo. And much less pag nagsasalita, kasi may iba, di ba? I don't know whether you've observed that ever, no? Pero may mga tao na they can't even complete a phrase or a sentence, and obviously
Yes.
that's a sign for shortness of breath. Then you need to be able to feed, drink adequately. Kasi kung wala yung mga wala yung mga qualities na yon, then kailangan mo na sigurong nasa facility para mabigyan ka ng either supplementation with oxygen and IV support for fluid and nutrition.
That's the thing, no, Doktora? Kailangan, parang with all the people I know who've had COVID, pag nahihirapan ng huminga, madali na mapagod, hindi yan mild. You're not on the mild stage anymore.
Correct. And Pinky, if I may, no, you shouldn't get to the point where ganun ka na bago ka tatakbo. Kasi hindi naman yan biglaan gradual din. So may observations, kaya nagmo-monitor ka. Kasi makikita mo tumataas or mas madalas mong mahit yung mga 35, 36 na RR, no? Or your pulse ox is starting to decline. The readings are starting to decline. So the value of that is your doctor should be able to pick those signs up early because they know what they're looking for. And because you're recording it, then you can see the trends. And that can be helpful in assessment.
So at least now we know what to keep at home, no? Siguro it's good to have that home care kit. Just one more question, one issue I'd like to ask you. Yung pong, how do we take care of ourselves when we need to go out, when we need to work? What are the things we need to drink, gargle, para po kahit papano protected tayo? Tanggalin na po natin yung mask and shield.
Babalik ko ulit doon kasi yun ang kailangan. No, yun talaga ang may proof.
But what I mean is, suot na natin yun. Suot na natin yung masking, yung mga double mask at may shield. How else can we protect ourselves? I'll ask you, kailangan yung mga gargle, do those work? Yung mga nasal spray, do those actually work as well to protect us?
So actually that was also asked in the Q&A for the Sanctuario session, no? Because there are a lot of articles now talking about these topical meaning you apply it to the nose or to the mouth by gargle, no? And supposed to be when they come into contact with the virus, they will be killed. No, the virus will be killed. Ang problema actually doon is we don't know how long the protective effect is going to last. So even as there is evidence that it can be helpful, those particular products, yung duration kasi nung action, medyo variable yan. Kasi, syempre, nasa surface lang siya nung lining ng mouth, nose, and throat. And therefore, kung meron man, kung gagamitin mo yan, that will still be just supplementary to the barriers that we typically use already.
Pero kahit pa paano makakatulong. I mean, it's not bad to have those antiseptic gargles and the nasal spray. But it basically you're saying that's not foolproof, obviously.
Well, it's not, no. And you would need to really use it according to the instructions of the manufacturer because they would have the basis or the studies that will be the basis for their dosing recommendations.
Okay, Dr. Anna Ong Lim, it's good to have you on the show. Thank you so much for your time.
Thank you, Pinky.
And coming up, Maginhawa Community Pantry resumes operations. We'll be speaking to DILG Undersecretary and spokesperson Jonathan Malaya after the break. This is The Source on CNN Philippines.